semaglutide versus Terzipatide.
Thank you very much. Thanks to the American Academy of Cosmetic Surgery, and thanks to Dr. Kaplan. So we're going to talk about Terzipatide and Semaglutide. Those are the two champions here. I used to do medical weight management almost full-time about 20-something years ago, and I never thought that I could do this. I heard one of my colleagues said that this is like manna from the desert, and I like manna. Manna from heaven is good. And I said, but there is no way I can do this. I'm busy, I love to do surgery, and I don't have time for this. What do my patients prefer, Semaglutide or Terzipatide? Well, they prefer Semaglutide. Why? Because it's cheaper, and it gives great results. What do I prefer? I prefer Terzipatide. Why? Because it has a greater weight loss and less side effects, right? So with Semaglutide, studies have demonstrated 15.1% of your body weight loss in 64 weeks. And with Terzipatide, we have about 22%. And this has been also corroborated in private studies in our own group. Thank you, Dr. Well. These are my disclosures. I appreciate the invitation. And I'm very pleased to talk about this because this is real. This is the revolution, right? This is the weight loss revolution. Everybody's on it. And if you're not on it, you should be. As a cosmetic surgeon, the thing that I hated the most, really, is to have a patient that I couldn't help. Somebody that comes with a BMI of over 40, we know the complications when you do surgery approach almost 50%. If you do it below 40, maybe you 2 or 3 or 4%, something like that. We have different cutoffs for when we do surgery, but I don't have that patient anymore. So the patient is above 40 or below 40 or wherever they are, even if they're not obese, we offer these medications are incredible. This is really a revolution, and I have no problem standing up in front of you and telling you this is way, way better than what we used to do 20-something years ago. The medications we used to use would give you hypertension. These medications not only help you with diabetes, not only help you with hypertension, but it also helps the surgeon because we can do this at any time. The one time we don't want to do this is 2 weeks preoperatively. So we start the patients whenever they're ready, and after surgery, we continue 2 weeks postoperatively. Obvious reason is that these medications cause delayed gastric emptying, and obviously you don't want to have a high risk of aspiration during surgery. But the bottom line is we don't turn down any patients right now. Everybody's happy, and I love to do a tummy tuck on these patients wherever they are. Ideally, I want to get them closer to 35, but as long as they're below 40, if that's what they want to do, we either put them on the weight loss medication until they achieve the BMI they want, or if they want to have surgery, we do the surgery. Then we put them on the weight loss medications, and then we do high definition liposculpture, and the results are incredible. As long as you leave them nice and tight, they're going to be good. Everybody's on the bandwagon here. You can see that facial plastic surgeons are also on it. Why? Because it's good for sleep apnea. It basically treats all the conditions associated with obesity, even acne and rashes, preoperative to surgery. If you have a large paniculus and there is irritation there, pre and post bariatric surgery. So it's not like this also helps because as you decrease the BMI, you decrease the risk and complications of that very surgery. But what about not having bariatric surgery at all? I had a patient that came to me, I saw her yesterday, and she was approved by Medi-Cal to have a free bariatric surgery, free gastric bypass,
and she refused. She said she wants to get on the medication. I thought she was crazy. She came and she lost 41 pounds in 1 month on this thing. It's unbelievable. And she's probably never going to get that gastric bypass. And then we'll do all the body contouring procedures that Dr. Kaplan was talking about. What about cancer? Wow. So obesity is associated with 13 different kinds of cancer. It's unreal. So when you treat this, what about the hemoglobin A1C? I have a cutoff of 7.5. So I had patients that have been on a hemoglobin A1C of 14, I couldn't operate on them. And I put them on these medications, and literally within 2 or 3 months, their hemoglobin A1C is less than 6 point something. What about long-term effects? I hear about this, I laugh. We have 20 years already. Ozempic has been used for diabetes for 20 years, since 2005. Oh, long-term effects. Well, we would already know about it, right? So what about the medullary thyroid cancer? Well, that was seen on rats, but it hasn't been seen on humans in all these diabetic population for the last 20 years. And so it's great to treat all these obesity-related conditions and even infertility. What is the first thing you do with a patient that has infertility? Even if they have polycystic ovarian syndrome, the first thing to do is get them to their goal weight. Then they can procreate, right? And then if they don't do it just like that, then you can induce them. But the main thing, first thing, is to get them to their goal weight, and then they can have children. So that's the thing about Ozempic babies, right? So what is Ozempic? It's Semaglutide, Mounjaro is Terzipatide, indicated for type 2 diabetes for many, many years with incredible results. This is the best medication. I'm a board-certified internist. We have never seen medication like this to treat diabetes. It is a miracle drug. Like Dr. Kaplan said, this is basically the best thing since penicillin. It's unbelievable. And the medications are the same medicines, but they got approved for weight loss, because guess what? The side effect was weight loss. That's unbelievable. So they got approved, and they're a different name, and these are once-a-week injections. And these are the dosages for Semaglutide and Tirzepatide. Very easy. And this is real stuff, okay? The people do lose the weight, they lose it fast. Who's a candidate? Everyone. Everyone, except if you have an allergy to the medication, which I haven't seen a single patient have an allergy to the medication, or if you have acute pancreatitis caused by the GLP-1, which we haven't seen one yet, or if you have medullary thyroid cancer, or if you have a personal or family history of multiple endocrine neoplasia type 2. So everyone is a candidate, and you can send it to everybody. You can send it to all your database. Everybody qualifies. The insurance companies, they do have their limitations, right? Now Kaiser rose up to, after losing a lot of money, the BMI to 40 if they want to give you medication. Well, that's best for us. We can give it to them, right? So this is as simple as it is, because I don't want to spend any time, and I don't spend any time on this thing, zero. The patient, we get a lead, somebody sends an email or a text, they get in the computer, they order the thing on their own. If they want to cancel a month later, they can cancel, and there is no, and then it's like shopping online. Everything very, very easy. What about if a credit card gets declined? I don't even know about it. You know, the computer just sends them a message that they need another credit card, and then they put it back in, and that's it. No hassle. What about these? Automated tracking, or no spreadsheets, nothing to write down. What dose are they in? I don't really care. It's all automated. I don't have to deal with any of that. So this literally takes very little time. Everything is auto-generated. What about writing a prescription? It takes me a while even to write electronic prescriptions for my patients to have surgery preoperatively. It takes, maybe a few minutes. We don't do that. It's all in the system. 18.9%. We're in the San Francisco Bay Area, and tomorrow, this is very important, you can put this link on your all social media and everything. They just click in there and go. And tomorrow, we're gonna have questions in a separate. Thank you. I'm sorry, a little bit over.
Cosmetic.